So let's wrap up the show with a member of that task force, the CEO of aged care provider Hammondcare, Mike Baird, joins me. Mike Baird, thanks for joining us. We heard the PM there in Catherine talking about the task force. The fundamental finding, basically, correct me if I'm wrong, but it's people who've got the means need to pay more for their care in the latter years of their life. That's basically it, isn't it?
Yeah, I mean, it's responding. I mean, as you just saw the Prime Minister outlined there, Kieran, there is this massive challenge. The ageing population brings incredible demands, and government can't fund everything. I mean, governments have finite budgets. So the question is, do we want our elderly Australians to get the quality care they needed? And the answer is, I hope yes. And in doing that, we need to find ways to help fund it. Now, you're right. What we're asking for, and it's not care. The care, the government is the recommendation is that care is provided, but the additional services, so the cleaning, the laundry, the food, and other services, that's where the contribution comes in, and that's the principle we're taking forward. And it's quite simple, Kieran. We're saying those that have the capacity or the means, not those in the system now, they are grandfathered, and no change is coming for those in the system. But longer term, asking those that have the means with a strong safety net for those that don't, but those that have the means to contribute something to that increasing funding gap and the demand that's coming.
And as you've articulated again today, this scope of challenge is enormous. You even looked at the prospect of the GST and potentially raising that. It gives you a sense of what we're talking about here. That this is a growing issue with the demographic time bomb, as it's called.
Yeah, I mean, it's exactly right, Kieran. And as you think about it, I mean, think of the pressures that are coming in NDIS. I mean, you've got defence pressures, you've got aged care pressures, but you've got health pressures. I mean, there is huge pressures that are coming not just on the federal government, but all governments. So looking for opportunities to fund what are essential critical services is something every government should do. And, at the moment, I'm heartened because you have this federal government that is looking at it and trying to tackle it. The federal opposition is certainly prepared to look at it and looking to be as constructive as possible. And I hope that continues. To me, this is the sort of thing, this sort of reform requires bipartisan support, and long term gives you an opportunity to do the reforms that are needed. It's not easy, but my hope is that that's the way we look at it, Kieran.
Anne Ruston, I've spoken to her on the program today. She said, yes, she's going to deal with this in good faith. She would have liked a bit more info earlier. I won't get your thoughts on that. I mean, that's the politics of the day. But at least she says, I'm willing to look at it in good faith. So in that sense, the hope for bipartisanship is alive, Mike Baird.
Yeah, Kieran, that's a big thing, and all credit to her and Peter Dutton in this, just the same to the aged care minister and the health minister and the Prime Minister. There's a chance, for that group, and Angus Taylor is the treasurer, to come together on this. They know the numbers. They know the challenges we're facing. I'm sure each and every one of them want our elderly Australians to get the quality care that they need. So here's an opportunity, for a generation or more to make the sort of changes that are needed. So, that's my hope. And certainly I've been heartened by that response, Kieran. So not every issue gets that opportunity. And this is such an important one. I really hope it does.
Mike Baird, appreciate your time. Thanks.
No problems at all, Kevin. Cheers.